NASM Personal Trainer Practice Test Series. Question 26. Where is the best place to measure the biceps? A. At the area with the smallest circumference, arm extended, deltoids relaxed. B. At the area with the smallest circumference, arm extended, deltoids contracted. C. At the area with the largest circumference, arm extended, palm downward. D. At the area with the largest circumference, arm extended, palm forward. Correct answer, D. The best place to measure the biceps is at the area with the largest circumference, arm extended, and palm forward. Question 27. What waist-to-hip ratio indicates a much higher risk for many diseases? A. Above 0.95 for women and above 0.80 for men. B. Above 0.80 for women and above 0.95 for men. C. Above 0.65 for women and above 0.70 for men. D. Above 0.70 for women and above 0.65 for men. Correct answer, B. The waist-to-hip ratio that indicates a much higher risk for many diseases is above 0.80 for women and above 0.95 for men. A high waist-to-hip ratio is indicative of excess fat stored in the midsection, which correlates to many chronic disease conditions. Question 28. At what BMI are the chances for obesity-related health problems increased? A. Between 25 and 30. B. Between 20 and 25. C. Over 20. D. Over 25. Correct answer, D. A BMI over 25 increases the chance for obesity-related health problems. As the BMI increases, the obesity classification does also, and the client's weight becomes more and more inappropriate for their height. Question 29. What is the correct mathematical equation for determining the body mass index? A. Multiply body fat percentage by weight. B. Subtract client's weight from 222. C. Divide body weight by height, kg per square meter. D. Divide body height by weight, square meters/kg. Correct answer, C. The correct mathematical equation for determining the body mass index is to divide body weight by height, kg per square meter. This provides a number that indicates whether or not the client's weight and height are appropriate and at a healthy level. Question 30. What type of assessment is the YMCA 3-minute step test? A. Cardiorespiratory. B. Respiratory function. C. Agility. D. Overall fitness level. Correct answer, A. The YMCA 3-minute step test is a cardiorespiratory assessment used to determine a baseline of cardiorespiratory health in order to determine at what level to commence the training regimen. Question 31. When performing the YMCA 3-minute step test, how long is the client instructed to rest after the 3 minutes of stepping before their pulse is measured? A. 3 minutes. B. 1 minute. C. 30 seconds. D. No wait, pulse is measured immediately. Correct answer, D. When performing the YMCA 3-minute step test, The client should be instructed to sit down immediately to have their pulse measured for 1 minute, starting measurement within 5 seconds of activity completion. This number is then inserted into an equation that determines in what cardiorespiratory zone the client will commence training. Question 32. In what cardiorespiratory category will a client with a good result from the YMCA 3-minute step test commence fitness training? A. Zone 1. B. Zone 2. C. Zone 3. D. Zone 4. Correct answer, B. A client with a good result from the YMCA 3-minute step test will commence fitness training at Zone 2. This measure of efficiency guides the health and fitness professional in planning what exercises should be included in the client's cardiorespiratory training. Question 33. After performing the Rockport walk test for the cardiorespiratory assessment, how long should the client rest before the pulse is checked? A. 3 minutes. B. 1 minute. C. 30 seconds. D. No wait, check pulse immediately. Correct answer, D. When performing the Rockport walk test for the cardiorespiratory assessment, the client's pulse should be checked immediately after walking the mile. The result is placed in an equation which results in a VO2 score and then indicates a heart rate zone. Question 34. What is the alignment and function of the kinetic chain components at any given moment? A. Posture. B. Balance. C. Equilibrium. D. Strength. Correct answer, A. The alignment and function of the kinetic chain components at any given moment is called posture. Good posture is the key to maintaining a good center of gravity over a support base. Question 35. What is the ability of the neuromuscular system to monitor and control the level of stress on the kinetic chain during functional tasks? A. Structural efficiency. B. Neuromuscular efficiency. C. Dynamic efficiency. D. Functional efficiency. Correct answer, D. The ability of the neuromuscular system to monitor and control the level of stress on the kinetic chain during functional tasks is called functional efficiency. The neuromuscular system can monitor and manipulate movement using the least amount of energy and consequently cause the least stress. Question 36. The ability of the neuromuscular system to perform all 3 action types, eccentric, concentric, and isometric, in all planes of motion is defined as what? A. Musculoskeletal strength. B. Neuromuscular strength. C. Functional strength. D. Structural strength. Correct answer, C. The ability of the neuromuscular system to perform all 3 action types, eccentric, concentric, and isometric, in all planes of motion is defined as functional strength. This ensures optimal neuromuscular efficiency through proper postural alignment. Question 37. What are predictable patterns of muscle imbalance? A. Dynamic distortion patterns. B. Postural distortion patterns. C. Myofascial distortion. D. Muscle fiber distortion. Correct answer, B. Predictable patterns of muscle imbalance are called postural distortion patterns. Improper posture leads to muscle imbalances and thus altered movement patterns, which causes undue stress to joints. Question 38. What information can be derived from dynamic postural observations? A. The presence of muscular deformities. B. Whether or not the client has followed a stretching regimen. C. The presence of over- and underactive muscles in their naturally dynamic setting. D. How successful the client has been in maintaining good dietary nutrition. Correct answer, C. The presence of over- and underactive muscles in their naturally dynamic setting can be derived from dynamic postural observations. These are simply made by observing the client in motion doing specific actions that reveal information about their movement patterns. Question 39. Which dynamic postural assessment assesses total integrated body strength and bilateral dynamic flexibility? A. Overhead squat assessment. B. Single leg squat assessment. C. Pushing assessment. D. Pulling assessment. Correct answer, A. The dynamic postural assessment that assesses total integrated body strength and bilateral dynamic flexibility is the overhead squat assessment. This is done by observing what movements, both correct and incorrect, the body reveals upon performing the overhead squat. Question 40. If a client's feet turn outward during the overhead squat assessment, which muscle is likely underactive? A. Soleus. B. Biceps femoris. C. Vastus lateralis. D. Medial hamstring. Correct answer, D. If a client's feet turn outward during the overhead squat assessment, the medial hamstring is most likely underactive. When this muscle is underactive, the LPHC may also exhibit lower back arches. Question 41. During an overhead squat assessment, the client's arms fall forward. Which muscle may be overactive? A. Biceps femoris. B. Latissimus dorsi. C. Deltoid complex. D. Erector spinae. Correct answer, B. During an overhead squat assessment, if the client's arms fall forward, it is likely that the latissimus dorsi is overactive. This assessment is made by observing the upper body during the overhead squat. Question 42. Which dynamic postural assessment reveals ankle proprioception, core strength, and hip stability? A. Single leg squat assessment. B. Overhead squat assessment. C. Pushing assessment. D. Walking lunge assessment. Correct answer, A. The dynamic postural assessment that reveals ankle proprioception, core strength, and hip stability is the single leg squat. For some clients, this assessment may be too difficult to perform and other methods of assessing movement compensations must be performed. Question 43. During the single leg squat assessment, if the client's knee moves inward, which muscle may be underactive? A. Adductor complex. B. Vastus lateralis. C. Gluteal muscles. D. Biceps femoris. Correct answer, C. During the single leg squat assessment, if the client's knee moves inward, the gluteal muscles may be underactive. Question 44. While observing the lumbopelvic hip complex during the pushing assessment, arching of the lower back is indicative of what? A. overactive hip flexors. B. Underactive erector spinae. C. Overactive core stabilizers. D. Underactive hip flexors. Correct answer, A. While observing the lumbopelvic hip complex during the pushing assessment, arching of the lower back is indicative of overactive hip flexors. This assessment can be viewed from a lateral aspect as the client performs pushing reps in a controlled manner. Question 45. During a pushing assessment, underactive deep cervical flexors are indicated by what inappropriate kinetic chain motion? A. Arching in the lower back. B. Shoulders elevating. C. Head protruding forward. D. Elbows turning outward. Correct answer, C. During a pushing assessment, underactive deep cervical flexors are indicated by the head protruding forward. This compensation also may indicate overactive upper trapezius, sternocleidomastoid, and levator scapulae. Question 46. Performance assessments are used for what purpose? A. To measure endurance and strength in the everyday casual weightlifter. B. To measure muscular hypertrophy in the power phase of the OPT model. C. To measure neuromuscular efficiency in the elderly. D. To measure stability, agility, and strength in clients trying to improve athletic performance. Correct answer, D. Performance assessments are used to measure stability, agility, and strength in clients trying to improve athletic performance. They are not suitable for all individuals. Question 47. The Davis test assesses which of the following? A. Overall fitness level in competitive athletes. B. Whole body proprioception. C. Lower extremity agility and stabilization. D. Upper extremity agility and stabilization. Correct answer, D. The Davis test assesses upper extremity agility and stabilization. It is not appropriate for those lacking shoulder stability. Question 48. Which performance assessment is used to test lower extremity agility and neuromuscular control? A. Davis test. B. Shark skill test. C. Bench press. D. Squat test. Correct answer, B. The performance assessment used to test lower extremity agility and neuromuscular control is the Shark skill test. This test is not appropriate for all clients because it is a progression from the single leg squat. Question 49. During the squat for the lower extremity strength assessment, how many pounds are added each time following the rest period? A. 5 to 10. B. 20 to 35. C. 30 to 40. D. 40 to 50. Correct answer, C. During the squat for the lower extremity strength assessment, 30 to 40 pounds are added each time following the rest period. This addition of weight continues throughout the test until the client reaches failure in performing 3 to 5 repetitions. Question 50. How many seconds are added for each fault during the Shark skills test? A. 1.0. B. 0.50. C. 0.10. D. 0.05. Correct answer, C. 0.10 seconds are added for each fault during the shark skills test. Faults include letting the non-hopping leg touch the floor, hands coming off the hips, foot going into the wrong square, and foot not returning to the center square.
Thank you to everyone for subscribing, rating, faving, and commenting my video and channel.